USMLE style question. Ventral posteromedial nucleus VPM of the thalamus. A 55-year-old man presents to the emergency department with numbness and decreased sensation on the left side of his face. He has normal motor function and no weakness. His body sensation is intact, but he has difficulty distinguishing temperature and pain on the left side of his face. A CT scan of the brain shows an ischemic stroke localized to the right thalamus. Which of the following is the most likely site of the lesion in this patient? A. Ventral posterolateral nucleus VPL. B. Ventral posteromedial nucleus VPM. C. Lateral geniculate nucleus LGN. D. Medial geniculate nucleus MGN. E. Subthalamic nucleus. Ventral posteromedial nucleus VPM. Explanation. The ventral posteromedial nucleus VPM of the thalamus is responsible for processing sensory information from the face and head via the trigeminal nerve, CNV, and gustatory pathways. Taste. A lesion in the VPM causes contralateral loss of facial sensation, pain, temperature, fine touch, and proprioception. Since the lesion is in the right VPM, the left side of the face is affected due to decussation of sensory pathways. Why other choices are incorrect? A. Ventral posterolateral nucleus, VPL, relays sensory information from the body, not the face, via the spinothalamic tract and medial lemniscus. A lesion here would cause contralateral body sensory loss, not isolated facial sensory loss. C. Lateral geniculate nucleus processes visual input from the retina via the optic tract. A lesion would cause visual field defects, not sensory loss. D. Medial geniculate nucleus, MGN, relays auditory information from the inferior colliculus to the auditory cortex. A lesion here would cause hearing deficits, not facial sensory loss. E. Subthalamic nucleus, involved in the indirect pathway of movement control. A lesion here results in hemiballismus, flinging movements of the contralateral limbs, not sensory deficits. Clinical relevance. VPM lesions typically cause contralateral facial sensory loss, sparing the body. The VPM receives input from the trigeminal nerve, CNV, and projects to the somatosensory cortex. Thalamic strokes involving the VPL and VPM together can cause contralateral hemisensory loss, face and body. In some cases, thalamic pain syndrome, Dejerine-Roussy syndrome, can develop, leading to chronic, intractable pain in the affected area. Would you like more